Now that workers across the health sector are receiving vital protective gear, health officials are ensuring that they also know how to use them properly. Today, they began another round of training, also integrating the evolving guidelines from the Centers for Disease Control in the United States on the management of Ebola patients or any other patients who may be contagious. Our Charisma Robinson takes a look.
She looked like she was on the scene of a science fiction movie. This woman in a large baggy white suit wore bright blue gloves with tape wrapped tight around her wrist and ankles. The head-to-toe protective gear is what first responders here in the Bahamas must wear if they ever have to face the deadly Ebola virus. And as the nation discusses Ebola preparedness, health workers across the Bahamas are undergoing training on what it takes to protect the public and themselves from the virus.
By following a certain guideline or protocol that has been set by your government. Again, it's looking at the borders that are open, of course, and that's really hard to really restrain because again there's the whole idea of your tourism, of course, and also then with the ports you got to have your import and exports. So with that, it's really going by the honesty of the people that are coming in, what they have been possibly exposed to, and then how are they feeling when they come in.
With the death of hundreds of healthcare workers in West Africa, local officials stressed that the National Emergency Medical Services guidelines must be strictly followed. The guidelines include a higher level of notification, limiting the number of personnel in contact with the patient, and donning protective gear.
It is a massive prevention. And again, there's always risk involved at all times. It really doesn't matter. But the thing is that looking at how can we best prevent it 99.9%. So by education and showing them how to do it, that's our goal.
CDC guidelines say just as important as putting the protective equipment on is taking it off.
Because remember, she's already been sprayed down really good, so that's the part of the disinfecting now. Okay, so now go ahead and peel out of your suit. And you're going to take it all the way down through your boots. Now, whatever your guidelines and protocols are, typically the boots are gone incinerated. Okay? I know that can be an expensive thing, but do you want to spread cooties? Probably not. Okay? So, all intents and purposes, though, for the training here, we'll just pull that down. Go ahead then, and good. You see how it's inside out.
The Ministry of Health has determined that the Fox Hill Clinic in New Providence is the designated location for extended isolations and management of Ebola cases. Any EMS worker who is exposed to blood or bodily fluids from a suspected or confirmed case of Ebola should seek medical attention promptly.
You don't want to have any panic or hysteria because there's really no need for that because again that just causes mass confusion. So with that, education and just understanding.
Officials are taking Ebola training throughout the Bahamas. They have already tackled Grand Bahama and will be here in New Providence over the next 2 days, ending in Abaco. Charisma Robinson, ZNS Network News.